9 early signs of dementia that few people know, and 13 classic symptoms of dementia. Senior health. Imagine forgetting your keys, then your friends' names, and eventually the faces of your loved ones. What if these are more than just signs of aging? These early signs of dementia are often ignored until it's too late. The truth is, not noticing these warning signals could mean losing your independence, your safety, and even the ability to recognize the people you care about. Don't wait until the confusion gets worse. Let's uncover the 9 subtle signs that could be silently affecting your mind and your future. Explore the latest medical advancements that offer hope to millions, and I encourage you to stay until the very end for a complete understanding. Shall we get started? Dementia is a term used to describe a range of symptoms associated with a decline in memory, reasoning, and other cognitive functions. It can affect daily life and is often seen in older adults. Understanding it is important for managing its effects and seeking appropriate support. Dementia is a group of symptoms that can affect cognitive abilities, including memory, language, thinking, and behavior. This condition can affect your ability to perform everyday activities and is often caused by injury or the loss of nerve cells in the brain. Dementia refers to a broad category of significant cognitive decline, rather than being identified as a specific disease. Dementia is not a normal part of growing older, even though it is more commonly seen in older individuals. This condition necessitates a precise diagnosis and attentive care. I kindly encourage you to take a moment to open your phones and search for my channel, especially considering how often you enjoy watching YouTube. Dear friends, I kindly encourage you to take a moment to watch this video. Your subscriptions and comments would be greatly appreciated. It is important to clarify any misconceptions. It's important to understand that normal aging does not equate to dementia. It's important to emphasize that dementia should not be considered a normal part of getting older. Most older individuals do not experience dementia, though it is important to note that the risk tends to rise as one gets older. It is quite common for individuals to experience mild cognitive changes as they age, including occasional forgetfulness. On the other hand, dementia involves a significant decline that affects daily activities. It is important to understand that confusion or memory loss in older individuals is not always a typical occurrence. If you have ongoing concerns, it is important to consult with a medical professional for a thorough evaluation. It's important to be aware of the 4 varieties of dementia that you should know about. Alzheimer's disease is the most common among the 4 types of dementia. Memory loss, difficulty with speech, and increasing changes in behavior are key indicators of this condition. Vascular dementia is a distinct type that arises from brain damage caused by circulation problems, such as strokes. It is important to be aware that cognitive changes, visual disturbances, and symptoms resembling Parkinson's disease are common features of Lewy body dementia. Frontotemporal dementia primarily impacts language, behavior, and personality. Understanding the different types is important for determining the most appropriate treatment approach. There are 9 early signs of dementia that may go unnoticed. 1 dot is having difficulty expressing itself. It's possible that you may not fully appreciate it. Experiencing difficulty in finding the right words during conversations can be an early sign of dementia. It may be beneficial for the individual to consider using clearer language or selecting more appropriate options. While occasional mistakes can happen, this issue may become ongoing and interfere with effective communication. It's possible that they may experience difficulty in naming everyday objects or phrases related to switching. Initially, you might not notice this sign, but it tends to worsen as time goes on. It is important to remain vigilant regarding this ongoing challenge for the sake of early diagnosis. The senses experience 2 important modifications, including hearing and vision, among others. It's important to be aware that early signs of dementia can manifest as changes in vision, hearing, smell, and taste. Taking note of these changes can be beneficial for your overall health. It is possible that the person may find it challenging to assess depth and distance, or to recognize familiar faces. It's not uncommon to experience hearing difficulties, particularly when trying to engage in conversations in louder environments. It is important to be aware of changes in taste and scent, as these can lead to a reduced interest in things that were once cherished. These changes in sensory perception can affect your quality of life and may indicate a potential decline in cognitive function. 3 dots may not provide the motivation needed to follow your passions. Please take care of yourself. One of the early signs that may suggest the onset of dementia is a noticeable decline in initiative. One may find themselves losing interest in initiating new projects or engaging in activities they once enjoyed. They may appear to be disinterested, lacking enthusiasm, or not exhibiting much energy. It's important to remember that long-standing interests and pastimes should not be overlooked. Feeling less enthusiastic about family gatherings or social interactions may indicate a decrease in motivation. This gradual shift in behavior may sometimes be misinterpreted as signs of depression. It appears that there may be a connection between the brain and 4-dot muscular weakness. In certain instances of Lewy body dementia and vascular dementia, you may notice that difficulties with muscle strength can serve as an early sign of dementia. It is possible for the individual to show signs of fatigue, experience muscle weakness, or have difficulty with precise movements. Even simple tasks, such as using utensils or buttoning a blouse, can present challenges. It's not uncommon to experience falls or difficulties with balance as we age. It is important to consider that these motor issues could suggest the necessity for further medical investigation, as they may arise prior to or in conjunction with cognitive decline. In familiar locations, 5 dots seem to have wandered off. In the early stages of dementia, it is quite common for individuals to experience spatial disorientation. It is possible for the individual to experience difficulties in following simple directions or may feel confused in places they usually know well, like their own neighborhood, when trying to find their way around familiar places or locate a specific spot at home. It is possible for them to feel disoriented. It can affect your ability to navigate and understand your surroundings. It's important to recognize that feelings of anxiety and frustration stemming from confusion can affect one's ability to maintain independence. There are 6 sleep issues that may provide valuable insights into your overall well-being. Changes in your sleep patterns could be an early sign of dementia. It is not uncommon for individuals to experience changes in their sleep patterns, which may include difficulty falling asleep, frequent awakenings during the night, or feeling excessively sleepy during the day. Sundowning, which involves a reversal of the sleep-wake cycle, may occur, leading to increased agitation and disorientation. These sleep abnormalities may affect your overall well-being and can also create challenges for those who care for you. Addressing sleep issues is a vital part of managing dementia effectively. 7 is slightly hunched over, concerns regarding posture and difficulties with walking. In certain instances, such as with vascular dementia and Lewy body dementia, it is important to note that postural abnormalities can serve as an early sign of dementia. One might notice some stiffness in the muscles, a slightly hunched posture, or difficulties with movement. It's common for individuals to begin moving at a slower pace, perhaps with some hesitation or taking smaller steps. Changes in posture may affect your ability to move and could increase the likelihood of falls. While they may begin as minor issues, it's common for them to progress over time. A consultation with a physical therapist can be very helpful in identifying and managing these changes effectively. Simple 8-dot assignments may become increasingly complex. One of the common early signs of dementia is having trouble with everyday tasks. Everyday activities such as using household appliances, managing bills, or cooking a simple meal may present challenges. It is possible for a person to feel confused by certain processes or find it challenging to perform tasks that once came naturally to them. Challenges like this can sometimes lead to mistakes, feelings of annoyance, and a sense of lost freedom to ensure timely diagnosis and appropriate support. It is important to keep an eye on any changes in your ability to carry out daily activities. 9 dots seems to prefer silence and does not wish to engage in conversation. Anhedonia, often referred to as apathy, can be an early sign of dementia that is important to recognize. It is not uncommon for someone to lose interest in activities they once found enjoyable, including social interactions and hobbies that brought them joy. They may appear to lack enthusiasm, motivation, and emotional connection. It is important to understand that while depression and apathy may appear similar, dementia usually does not present with the same deep sense of sadness. It's important to recognize that this disengagement can have a negative impact on both relationships and overall quality of life. It is important to recognize and address apathy as a key component in the treatment of dementia. It is important to be aware of the 13 key signs of dementia that should be recognized. It seems you may be experiencing a significant sense of disorientation regarding your surroundings and the passage of time. One of the well-known indicators of dementia is disorientation. It is possible for a person to feel a bit confused and may not accurately perceive the time of day or the current season. It is not uncommon for individuals to experience difficulties when trying to return home or navigate to familiar locations. It's not uncommon to experience a sense of disorientation regarding both space and time. It is important to be aware that this may result in feelings of confusion and anxiety, which could increase the likelihood of encountering difficult situations. To help with disorientation, it can be beneficial to use techniques such as calendars, labels, and established routines. Planning and problem-solving can present some challenges. It is quite common for individuals to experience challenges with planning and problem-solving as they age, and these can sometimes indicate the onset of dementia. It can be challenging for someone to handle finances, work with numbers, or adhere to a plan. Engaging in complex tasks such as planning an event or organizing travel can indeed present significant challenges. It appears that reasoning and problem-solving skills may not be functioning at their best. It's important to be aware that this may lead to some errors, feelings of frustration, and a sense of lost freedom. It may be beneficial to simplify tasks and provide support as needed. 3 dots misplacing items. A frequent indicator of dementia is when individuals place items in unsuitable locations. It is quite common for individuals to place items in unusual spots and later have difficulty recalling their whereabouts. It's not uncommon to find food in drawers, clothing in the garbage, or even keys in the refrigerator. This behavior may lead to feelings of confusion and annoyance, as well as potential theft charges. It is important to focus on preventing conflict, cultivating effective organizational strategies, and practicing patience. It may be helpful to set aside specific places for essential items, for significant changes in behavior or emotions. It is quite common to observe changes in behavior or mood as potential indicators of dementia. It is not uncommon for individuals to experience sudden shifts in their mood, moving from a state of calmness to feelings of irritation or sadness without any clear cause. Behaviors such as aggression or sexual disinhibition can be considered inappropriate conduct. It is not uncommon to experience social disengagement and feelings of apathy. Changes can indeed affect relationships, and this can be quite challenging for those who are providing care. It's essential to understand that these behaviors are not intentional. They are indicators of dementia. Implementing techniques for behavioral management and communication can be quite helpful. Incontinence related to fecal or urine can be a challenging issue to manage. Experiencing incontinence of urine or feces can sometimes be a sign of more advanced dementia. It's important to discuss any concerns with a healthcare professional for proper guidance and support. It is possible that one may have difficulty recognizing the appropriate moments to visit the restroom or may find it challenging to reach it in a timely manner. It's important to be aware that sphincter control may be at risk. It's important to be aware that this situation may result in caregiver stress, hygiene concerns, and feelings of shame. Consider using incontinence products, opting for easily accessible clothing, and setting up frequent reminders as helpful strategies to manage this delicate issue. 6 instances of seeing dots that aren't there. It is important to be aware that symptoms of dementia, especially in the case of Lewy body dementia, can sometimes involve experiencing hallucinations. It is indeed possible for individuals to perceive, hear, or feel sensations that may not have a basis in reality. It is quite common for individuals to experience visual hallucinations, which may involve seeing people, animals, or objects that aren't actually present. They may seem quite intense and vivid. It is important to understand that some individuals may experience auditory hallucinations, which can include hearing voices. It's important to recognize the individual's feelings while refraining from validating the reality of the hallucination. It may be beneficial to consider medication and redirection techniques. Concerns regarding short-term memory with 7 dots. Short-term memory issues can often be associated with dementia. It is possible for a person to become a bit forgetful about recent events, conversations, or appointments. It is quite common for individuals to revisit the same questions or recount the same stories repeatedly, often without awareness that they have already discussed them. It is quite common for past events to hold on to their long-term memory for a while. Experiencing memory loss can lead to feelings of confusion, frustration, and a greater reliance on those around you. Using life stories, pictures, and textual reminders can be quite helpful. Social isolation can be quite challenging. One of the most common indicators of dementia is social isolation. It is not uncommon for someone to lose interest in social interactions and withdraw from activities they once enjoyed. It is not uncommon for individuals facing cognitive and communication challenges to experience discomfort in social situations. It is important to recognize that isolation can be worsened by the stigma and lack of understanding related to dementia. This withdrawal may accelerate cognitive decline and affect your overall quality of life. It could be beneficial to encourage participation in support groups and adjusted activities. Inappropriate behavior can be represented by 9 dots. One of the possible indicators of dementia is exhibiting behavior that may seem inappropriate. Sometimes, individuals may exhibit behaviors that seem a bit out of place in public settings, such as speaking or acting in ways that might not be considered appropriate. It is important to be mindful of engaging in behaviors that may be considered inappropriate, such as exhibitionism or making advances. It is not uncommon to encounter aggression, both verbal and physical, especially when it comes to self-care, for those who provide care. These tasks can often feel challenging and uncomfortable. It's important to remember that these are indications of the condition, not intentional actions. It's important to consider how environmental changes, gentle communication methods, and redirection strategies can be quite helpful. There seems to be a question that includes a repeated 0 dot. A frequent indication of dementia is the repetition of questions. It is not uncommon for someone to seek clarification and ask the same question again, shortly after receiving an answer. This is due to challenges with short-term memory and difficulties in retaining new information for those who care for others. The constant repetition can indeed be quite tiring and disheartening. It is important to respond with calmness and patience. Using clear and simple language, it may be beneficial to consider using visual or written reminders. 1 dot is having some difficulty keeping pace with conversations. A common indication of dementia is experiencing challenges in keeping up with conversations. It may be challenging for the individual to engage in conversations, especially in noisy environments or among large groups of people. It is possible that they may find themselves distracted by the conversation, having difficulty locating the appropriate words, or facing challenges in expressing their thoughts clearly. This may lead to misunderstandings, feelings of annoyance, and a sense of social disengagement. It is important to speak slowly and clearly, using short phrases, and to give the person ample time to understand the information. Minimizing background noise and other distractions can indeed be quite helpful. Time awareness can diminish with just a single moment. A notable indicator of dementia is a diminished awareness of time. It is possible for someone to confuse the current year, month, or day. It is possible that they may experience difficulties in remembering important dates, like appointments or birthdays, when an individual perceives that recent events took place a considerable time ago, or the opposite. It can create a sense of distortion in their understanding of time. It is important to recognize that this temporal disorientation can lead to confusion and disruptions in your daily activities. Maintaining a sense of time can be aided by the use of clocks, calendars, and structured routines. Making decisions with a three-dot approach can indeed be quite challenging. A common indication of dementia is experiencing challenges in making decisions. It may be challenging for someone to evaluate options, weigh the pros and cons, or come to a conclusion. Sometimes, even simple choices such as what to eat or wear can feel quite challenging. It is important to be cautious with more complex decisions, particularly those related to finances or health, as they may carry significant risks. This situation might lead to feelings of uncertainty, nervousness, and a reliance on others for support. It can be quite helpful to offer a few clear choices and allow ample time for making a decision. Understanding the causes of dementia. Dementia can arise from various health conditions, with Alzheimer's disease being the most common among them. The presence of abnormal protein accumulation in the brain leads to the death of nerve cells in Alzheimer's disease. Circulation issues, like strokes, can lead to brain damage, which may result in vascular dementia. There are additional factors to consider, such as frontotemporal dementia, which impacts the frontal and temporal lobes of the brain, and Lewy body dementia, characterized by the accumulation of the protein alpha-synuclein. It is important to be aware that an unhealthy lifestyle, cardiovascular illnesses, family history, and advanced age can all contribute to certain health risks, preventing dementia. Managing diabetes can be as simple as focusing on a single point. Managing diabetes properly is an important step in helping to prevent dementia. Higher blood sugar levels may affect brain function and can be detrimental to blood vessels. Maintaining blood sugar levels within suggested ranges can help reduce the risk of dementia. A healthy diet, regular exercise, and medication when necessary are important steps to consider. Managing diabetes can also enhance heart health, which is an important consideration for cognitive well-being. 2. It's time to consider quitting smoking. One significant step you can take to help reduce the risk of dementia is to consider quitting smoking. It is important to be aware that smoking is associated with an increased risk of dementia, especially vascular dementia and cognitive decline. Smoking can hinder the flow of blood and oxygen to the brain by causing damage to the blood vessels, even in your later years. Stopping smoking can enhance brain function. There are helpful resources available that can make the quitting process easier, such as behavioral support and nicotine replacement therapy. Stress can be effectively managed by focusing on 3 key points. One important approach to help prevent dementia is through effective stress management. Long-term stress can have a negative impact on memory and cognitive function. It's important to consider gentle methods for reducing stress, such as deep breathing, meditation, and engaging in calming activities. It is important to nurture healthy social connections, engage in enjoyable hobbies, and find a balance between personal and professional responsibilities, as these elements significantly contribute to your mental well-being to help prevent cognitive decline. It is important to remember that emotional well-being is just as vital as physical well-being. Your mind is often engaged by 4 dots. Engaging your mind regularly can help you maintain cognitive health and potentially reduce the risk of dementia. Engaging in mentally stimulating activities such as word games, puzzles, learning a new language, or playing an instrument can help strengthen your brain connections. Engaging in thoughtful discussions, as well as writing and reading, can be quite beneficial. Engaging in these exercises can help support the brain's flexibility, ensuring it remains active and resilient. For the best results, It's important to choose enjoyable hobbies and vary the activities you engage in. Engaging in physical activity is quite beneficial. Engaging in regular physical activity is very important for preventing dementia. Engaging in regular exercise can enhance blood circulation, allowing your brain to receive a greater supply of oxygen and essential nutrients. Additionally, engaging in regular exercise encourages the production of growth factors that are beneficial for maintaining the health of your neurons. It is beneficial to participate in gentle aerobic activities like dancing, swimming, or brisk walking for a minimum of 150 minutes each week. Engaging in exercises that focus on balance and strength can be quite beneficial. To ensure lasting commitment, it is important to discover enjoyable activities that are suitable for each individual's physical condition. 6 dots remain actively involved in social interactions. Engaging in social interactions is an important strategy in managing dementia. Engaging in social interactions can greatly enhance your emotional well-being, stimulate your mind, and reduce the risk of isolation, which can contribute to cognitive decline. Engaging in group activities such as volunteer work, art classes, or book clubs can be quite beneficial. It's important to nurture meaningful connections with your loved ones. Maintaining long-term brain health can be greatly supported by staying socially engaged. This involvement provides valuable opportunities for communication, emotional support, and cognitive stimulation. Your sleep has shown an improvement of 7 points. Improving the quality of your sleep is an important approach to help prevent dementia, ensuring cognitive function, eliminating brain pollutants, and strengthening memories all rely on obtaining sufficient sleep. Establishing a regular sleep schedule with consistent wake and sleep hours can be quite beneficial for your overall well-being. It may be beneficial to create a comfortable sleeping environment, avoid screens shortly before bedtime, and incorporate relaxation exercises into your routine to achieve restorative sleep. It is important to address issues such as sleep apnea. Weight loss can be accomplished with 8 dots. One approach to potentially reduce the risk of dementia is to maintain a healthy weight, should it be necessary, in middle age. It is important to be aware that obesity can be associated with an increased risk of dementia and cognitive impairment. Carrying excess weight can lead to issues with blood vessels, contribute to inflammation, and affect brain function. Achieving and maintaining a healthy weight is certainly possible by enjoying a balanced diet rich in fruits, vegetables, whole grains, and healthy fats, along with regular physical activity over time. Making small, lasting changes to your lifestyle tends to be more effective. The cognitive reserve associated with 9 dots. One approach to help prevent dementia is to enhance cognitive reserve. Cognitive reserve refers to the brain's ability to endure injury or illness while still maintaining its cognitive functions. This reserve is developed through a combination of factors, such as education, engaging in complex work, and consistently participating in mentally stimulating activities throughout life. A greater cognitive reserve in the brain can enhance its resilience in facing challenges. Engaging in an intellectually stimulating lifestyle, pursuing challenging hobbies, and continuing your education can be very helpful strategies. Your diet has seen an enhancement of 1 0 point. Improving your nutrition is one of the most important steps you can take to help avoid dementia. A nutritious diet provides the essential nutrients needed for optimal brain function. Embracing a Mediterranean diet, rich in fruits, vegetables, whole grains, fish, nuts, and olive oil, may help reduce the risk of cognitive decline. It's important to be mindful of your intake of processed foods, added sugars, and saturated fats, including foods rich in antioxidants, such as berries and leafy green vegetables, along with omega-3 fatty acids found in walnuts and salmon, may be beneficial for brain health. A single dot can help manage cholesterol levels and blood pressure effectively. To help prevent dementia, it's important to manage your blood pressure and cholesterol levels effectively. It is important to be aware that elevated blood pressure and cholesterol levels can be associated with an increased risk of vascular dementia and cognitive decline. These elements may pose risks to your blood vessels and can affect the delivery of oxygen and nutrients to the brain. Maintaining normal levels of blood pressure and cholesterol is achievable through a balanced diet, regular physical activity, and effective stress management. In some situations, it may be necessary to take medication as advised by your physician. Recent progress in the care and support of individuals living with dementia. The research surrounding treatment for dementia is continually evolving. While there is no treatment available at this time, recent research is focused on slowing the progression of the disease and improving quality of life. Researchers are exploring stronger medications to help address behavioral and cognitive challenges, engaging in cognitive stimulation, participating in occupational therapy, and enjoying modified social activities can offer significant benefits without the need for medication. Advancements in early detection through the use of biomarkers and imaging tests can facilitate timely interventions. Researchers are exploring advanced strategies such as gene therapy and immunotherapy in their quest to discover therapies that can modify diseases. In summary, a more positive mental outlook awaits you. Many individuals around the globe are affected by dementia, which is a complex condition. It is important to recognize the early warning signs, key symptoms, and underlying causes of dementia for better awareness and timely diagnosis. While a cure is not available at this time, you can take steps to prevent the condition by maintaining a healthy lifestyle, managing risk factors, and participating in activities that stimulate your mind. Recent advancements in therapy, driven by continuous research, offer promising prospects for improving the quality of life for individuals living with dementia. Taking care of your brain health over the years is a thoughtful choice for ensuring good cognitive function in the future. Please take a moment to consider signing up for the channel. It could be quite beneficial for you. I sincerely wish for your well-being, prosperity, and happiness. I look forward to seeing you in the next video.